Hi, my name is Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is July 15th, and this is our COVID video update. And I'm here with Juliann, who I think you haven't seen for a little bit. Juliann, do you want to say hello?
Hello again, everyone. Juliann Van Liew, the Director for the Unified Government Public Health Department.
Well, thanks for being back on our videos. We have just kind of a bigger COVID update today of where things are and what we're doing with that and what individual people need to know. So to kind of start off, do you want to just give the picture of what we're seeing with COVID right now in Wyandotte County?
Absolutely, thank you. I wish that I could report better news. Unfortunately, our 7-day rolling average of new cases is back to where it was in February. And if you think back to then, we were making a lot of pretty conservative decisions around keeping ourselves masked, staying distanced. And so we're in a place now where we're averaging again about 30 new cases a day, which is quite a few, and where we need to start getting back to that mindset of taking those precautions again. Our percent positivity of cases that are being tested is also increasing drastically from where it was 6 or 8 weeks ago. So more and more folks who are getting tested are then getting positive test results, unfortunately. And lastly, what I know a lot of people have already heard about, but the Delta variant is really taking hold here in Wyandotte County, as well as in the entire metro. So many of our cases are now being sent to the state lab to be sequenced to see what kind of COVID it is. And an increasing amount of those every week are coming back as Delta. And that's worrying to us because Delta spreads much quicker and it can make people sicker as well. And so especially in those indoor spaces when people are together and near one another, we're just really worried about Delta continuing to spread in those settings.
Yeah, and another thing with Delta, and I believe our cases in general, we're seeing a lot of those among younger people, because largely, I think, because we see lower vaccination rates among young adults, and they're still a bit lower among 12 to 17-year-olds as well.
That's absolutely right. Unfortunately, we're seeing a number of outbreaks in many counties in the metro in summer-based camps, in sports and recreation activities with our youth, because in a lot of those settings, they've really reduced the requirements for mask wearing, and that's led to Delta and other variants continuing to spread. And we just need to continue to remember that the folks under 12 in our community don't even have the opportunity to be vaccinated, even if they or their parents wanted them to be. And so our youth do remain at high risk. And contrary to often popular belief, kids can get COVID, and they are getting COVID at a higher rate now than they were this spring.
Yeah, it's tough to keep in mind because I know people are ready to they want to move past all of this, but we're just not there quite yet. But there is some good news. I mean, this is all, a little bit harder to talk about, but there are some good things going on. Do you want to talk more about what's being done to address this right now?
Absolutely. So we continue to do our best to get creative to help people get vaccinated, whether it's removing barriers to accessing the vaccine or our new initiative around incentivizing the vaccine. And we know that this isn't the right choice for everyone. Not everyone's going to hear about an incentive and run out to get vaccinated, but there are some people who are inspired by the incentive program, and we're happy to say that it has boosted our numbers somewhat. So this second phase of our vaccine program that just started yesterday is called Spin to Win. And it's a fun one. If you come out to our Kmart site and you get vaccinated, you get to either put your name in a drawing for $500 or you get to spin a wheel and win a prize. And on that Spin to Win wheel, there are public health t-shirts, there are $50 gift cards, $25 gift cards, and there are smaller $10 restaurant gift cards for local restaurants around town and others. And so really everybody gets to choose, do they want to be in the big raffle, do they want to spin to win for an instant prize? And just yesterday on our first day, we saw huge excitement around this, and we heard people talking about telling their friends and it being the reason that they came in that particular day. So our hope is that people will continue to spread the word. It's just a fun extra thing you get to do when you come to get vaccinated. So on top of helping yourself and your community, you get to take a prize with you.
Yeah, I was there part of the day yesterday, and people were definitely having fun with the spin to win. And I don't know, it just feels like you're playing a, well, it's a game that you get to play on your way out, and you get something to take home.
That's right.
Um,
We're
I,
also continuing to be creative about bringing vaccines to people. So if the Kmart site or health department or elsewhere isn't convenient for you, we'll again be out at some Sporting KC games later this month. We'll be out at the Monarchs game tomorrow evening. We continue to partner with churches, with USD 500 and other school districts to be on site at those locations. So just keep your eyes and ears out for our social media and online to see where our mobile unit will be. There's just a lot of opportunities these days for folks to get vaccinated through us or elsewhere.
right. And something else that people can go online or call is for some of the free resources that are available as well, like getting a free ride to or from the vaccine site for you or your family. There's still the option to get a COVID test delivered to your door. If you have been exposed to COVID or you have COVID and you need to quarantine or isolate, you can get free quarantine housing. So all of that, you can, find out more and request assistance by calling 311 or going to wycovaccines.org. So what can individuals do? Like what, if I'm thinking, okay, we're seeing the cases going up, um, what should I do in my day-to-day life to protect myself and others?
Vaccinations, of course, are our primary and one of our biggest lines of defense right now. And many people who watch this video have probably been vaccinated, but I guarantee there are people in your lives who have not. And this is really a community. It has to be a whole countrywide effort, because as long as there are pockets of folks in our community who are unvaccinated, that leaves room for this virus to not only spread, but to mutate. And so the best weapon many of us have at our disposal is just having a conversation with the people in our lives who maybe haven't made that choice to go get vaccinated yet. People report that the primary people who can convince them to get vaccinated are their doctor or their friends and family. And so friends and family have a tremendous amount of respect and weight and power with the people in our lives whom we've loved. So we encourage people to have those sometimes difficult conversations. We also do want to remind people to keep getting tested. That's how we know who and how many people in our community have COVID right now and have the ability to spread it. It's how we know whom to tell to quarantine and isolate. And of course, back to that message we've been spreading for a long time, which is that if you are unvaccinated or even vaccinated but immunocompromised, please wear that mask, especially when you're indoors. It's hard to overstate how powerful those simple pieces of cloth or paper can be, especially with something like Delta running around and transmitting so easily. A simple mask can really do wonders in a situation like we're in.
All right, thank you for that. It's always good to have the reminders of, I know we've been hearing a lot of that along the way, but it's still incredibly important. Well, thanks for this update. Any final thoughts before we wrap up?
No, just come out and spin to win. It really is fun, especially if you've got, kids 12 to 18 who haven't been vaccinated yet. It's just a way to make the whole vaccination process a little more exciting, a little more fun, and send people home with some prizes, which everybody loves. So come out and see us.
All right, thank you. We'll see you next time.